It's the Summer Breakfast with Wilhelmina Shrimpton on Magic Talk.
While we were working to protect ourselves from COVID during the lockdown, for some, protection from other ailments and illnesses fell by the wayside. New Zealand has one of the highest rates of skin cancer in the world, with more people dying from melanoma than on our roads. But the pandemic has prevented people from getting regular skin checks, a dangerous game as we head into the summer season. Auckland plastic surgeon and skin cancer specialist, Dr. Katarzyna Mackenzie, joins me now live. Kia ora, good morning.
Good morning. How do you do?
I'm good, thank you. Thank you so much for joining us this morning.
It's a pleasure. Thank you.
Tell me, just how much of a dip have health professionals seen in skin cancer checks and referrals over the past few months?
Oh, well, as we all know, the COVID-19 pandemic has presented quite a unique set of challenges when it comes to cancer treatment all around the world and even New Zealand. But, we have to remember that skin cancer does not stop during the lockdown. But what we have seen over the last few months or even, the last year, we have seen fewer referrals for treatment, skin cancers coming. And, you may be aware that even more of New Zealand statistics show that skin cancer screening rates have decreased dramatically during lockdown, especially during lockdown last year. Although it's difficult to comment on the effect of this year lockdown on the cancer treatment in New Zealand.
Just how dangerous can it be for Kiwis delaying this? I mean, I know that there have been other priorities over the past few months, but what are the costs of that?
Oh, it can be quite dramatic. You have to remember that, when the patients present with delayed diagnosis of skin cancers, that can lead to more advanced disease, including metastases to local organs or lymph nodes. They also present with cancers which are much bigger to treat. And, when we are presented with a large skin cancer that often requires much larger reconstruction, hence the complication profile increases. And you have to remember, majority of our population who present with skin cancers, they are elderly patients with other comorbidities. And if we put them through quite complex reconstructions, that can be potentially life-threatening for them.
Just how often should people be getting checked? Is it once a year, every 6 months, or does it just depend on the individual person?
It very much depends. You have to remember, having had one skin cancer puts you at higher risk of having more in the future. There is no question about it. And, usually if you have one skin cancer, you are likely to get another one within the next 3 years. And depending on what type of skin cancer you have, then we usually recommend 3 monthly, 6 monthly, or annual checks. But it all depends on skin cancer. However, you also have to remember, if somebody has got a history of a family history of skin cancer, or if someone has got multiple moles and it's difficult to keep an eye on them, it's probably really good to have your skin checked by the general practitioner at least once a year.
What should people look for on their skin if they haven't been able to make it in? They might not be able to make it in before Christmas. What are the telltale signs that something's not quite right?
So what I usually tell my patients, if you've got a skin lump or skin change which is not going away after 3 or 4 weeks, or if you have had a long-standing mole, for example, and it starts changing suddenly, and we're talking about the size, the color, the border, or, it becomes painful or itchy, you must have it checked. But what I say to my patients, look, if you look at your skin and you see something and it's got this ugly, ducky appearance, go and have it checked.
Now, mole maps are quite expensive. It's not something you can just kind of rock into and get at a discounted price. With people being made redundant and businesses closing, there's a lot more financial pressure on Kiwis, and they might not actually be able to afford this service anymore. What's a viable alternative for them? I know you can get, a couple of moles checked at your GP, but if you want a full map?
I think a lot of full body checks are offered by GP. So really, when you want to have it checked by a specialist or a doctor, you've got two options. One is to go to MOMEP, which, as you said, can be expensive for a lot of people, or go and see your GP. I mean, $75 a year, which can save your life, is actually not much when you look at the spectrum of potential risks associated with skin cancer being missed. And as I said, be vigilant yourself. So as I've mentioned before, if you notice something on your skin, go and have it checked immediately.